How much peppermint oil is too much? Have you ever wondered how much peppermint oil is safe to take, especially if you have irritable bowel syndrome or a sensitive stomach? Many people turn to peppermint oil for relief from symptoms like abdominal pain and bloating. But how much is too much? For those dealing with irritable bowel syndrome, the commonly recommended dose is between 0.2 to 0.4 milliliters taken 3 times a day. This usually translates to about 180 to 400 milligrams per dose. It is best to take these doses before meals, and they often come in enteric-coated capsules designed to release the oil in the intestines. If you are giving peppermint oil to children who weigh less than 45 kilograms, a lower dose of 0.1 milliliters 3 times a day is often suggested. However, taking more than the recommended amounts can lead to some unwanted side effects. For instance, higher doses can cause heartburn, belching, nausea, and stomach pain. In some cases, it may even worsen symptoms like diarrhea or anal burning. This is particularly important for those with sensitive digestive systems, as excessive peppermint oil can irritate rather than soothe the gastrointestinal tract. If you have irritable bowel syndrome or colitis, there are a few things to keep in mind. Peppermint oil can relax the lower esophageal sphincter, which might worsen acid reflux or heartburn. If you already struggle with these issues, it is wise to be cautious. For those experiencing chronic diarrhea, it is best to avoid peppermint oil until symptoms improve. Rapid transit can cause the oil to reach the colon quickly, leading to irritation. Additionally, peppermint oil may interfere with iron absorption. If you have anemia or low iron levels, it is advisable to steer clear of peppermint oil. It is also essential to consider potential interactions with medications. Peppermint oil can affect how some drugs are metabolized. Therefore, consulting with a healthcare provider before using peppermint oil is important. Pregnant or breastfeeding women and very young children should avoid peppermint oil due to safety concerns. To sum it up, for those with sensitive stomachs, irritable bowel syndrome, and colitis, sticking to the recommended dose of about 0.2 to 0.4 milliliters 3 times a day is the safest approach. Going beyond this amount can increase the risk of gastrointestinal irritation and other side effects. Always consult a healthcare professional before starting peppermint oil, especially if you have a sensitive digestive system or other health conditions.